Let me thank the Renal Research Institute for the invitation and to tell you how I started in this innovation world. And let me start with a question. How many of you consider yourself innovators? Raise your hands. So I will say 25, 30%, so not so many. I hope that by the end of this symposium will be at least 50%, let's hope. And let me tell you that at the time that I started my startup, my main goal was to find a PhD program in the States. Okay, so I spent like a month at UPenn with a nursing professor trying to figure out how to do that, when something came to my mind in Spain. It was a hackathon. That hackathon was organized by MIT and the MIT Hacking Medicine, and by the time I didn't know what this was. So for those who doesn't know, a hackathon is an event where people came together with different backgrounds, engineers, nurses, user experience designers, MBAs people, and we spent a whole weekend together trying to figure out how to solve different real problems that people with chronic diseases had. And we had an idea, and that idea was focused on my grandmother, because at the time, and this is AI generated by ChatGPT, this is not my real grandma. So my grandmother was living alone with chronic kidney disease, heart failure, diabetes. She had a couple of heart attacks, and she wanted to live at her home, and she didn't want to join us with any of the family members. She didn't want to change any of their daily routine, so we as family and caregivers, we had an issue because we were really worried because she was living far away. So the problem that we had at the team was how we could solve this problem and be really sure how my grandma, in this case, is. And we came with an idea to monitor the status and the health status of my grandma, monitoring samples into their daily routine without changing anything. Can you imagine in which place at the home we were collecting the samples? Anyone? No? I will tell you, I was yesterday visiting the NASA Space Center, and they have one at the International Space Station. The toilet. So we figured out that everyone wants go to the toilets every day. So we, over that weekend, we were developing a prototype to put inside the toilet that will collect automatically urine samples and send it via SIM card to the cloud, to a dashboard where clinicians, patients, and family members, we could track how, in this case, my grandmother was at home and be notified when something was wrong. With that idea, we won a prize from MIT, and for me it was fabulous, because at that time, as I was telling you at the beginning, I was looking for something to do my PhD in the States. And I arrived at MIT by September 2016, and by December, I already got an offer from the HST to do my PhD there. So at that moment, my, my decision was, should I go and pursue my PhD at the MIT, or should I go with the toilet thing? What do you think? So the result is that, of course, I went with the toilet thing. It was more rewarding and inspiring, but thanks to this Idea Square program with mentors from MIT, Harvard, Mass General, they really trained me and my team. They mentor me, and they really ask the right questions, and they don't judge. People really want to help because, for example, when I was at the hospital and I told my coworkers, I am developing this for the toilet, they say, are you crazy? What is this? And then you have people at those top-tier universities, when you tell the idea and they don't tell you you're crazy, they tell you how you're going to do it, why are you going to do it, how is the strategy to pursue and achieve these goals. And this is what is really inspiring about those kind of programs. From that, we went from prototype to really patent advice that it led us to run clinical trials. We started the first phase in April 2019, and we ran it with more than 300 patients. And we were focused on diabetic nephropathy patients, and we were providing semi-quantitative results because we were not using any biosensors. It was everything optical, so this is the reason it was semi-quantitative. But we were focusing on ACR and albumin and also another parameters like detecting blood or glucose in the urine. But we were supposed to run the second phase and the usability testing in 2020, starting on May, and the pandemic hit, like everyone knows, and we had to shut the project down. It wasn't easy, but I learned that the innovation doesn't end with a project. It really is something that teaches me how it should be part of my life, in my professional life. And also another thing I wanted to mention is that sometimes we can mix invention with innovation because it kind of sounds similar, but invention maybe is not bringing us anything to the table, like these tiny umbrella shoes. So I don't know if you ever are going to use it, but it is something that someone created. It's an invention. It's like maybe it could be patented like my device, but we don't know if it's really bringing something. And innovation, in another way, is applying something that could be new or not, and is transforming ideas in meaningful improvements in products, services, or ways of doing things that create value. And this is the most important thing for me. So we need to create value, and this is what innovations brings, and that is different from innovation. Create value, as I said, could be in product and services, and I will tell you an example for us. This is an example that we have talked about before by the first panel discussion by Marielka and Joaos from Portugal. This is the cannulation technique we mentioned before. So it was developed by a group of nurses in Portugal because they really needed that into their daily practice. And this has proved that over the years and by the research that we have fewer complications in AVF, that we have better patients' comfort and experience. So we actually have patients requesting us when I can be inside this cannulation technique. And also it's easier and safer for our nurses because we have a lot of turnover and new nurses coming in. And they really, after a few weeks, we already, the spots that you see in the arterial and venous AVF part, they already can see the spots, and the patients are the one telling to the nurses, today you have to cannulate here. So, and this is really important when they are also are hospitalized or they are going on vacation to another clinic. And this is another part that as leaders, I believe is really important. And I really like the Mayo Clinic presentation. I don't know where you are, but I really like it because it's the same way that we want to go in Spain. So, and it's create this program for nurses that probably we will be expanding to other people in the clinics to create these resources, training, and mentorship to foster innovation across the country. Because they were discussing, and most of the people vote at the beginning, that the main barrier for nurses was the time, but I not agree. It's because we as leaders are not creating that time for them. And this is why this program is coming into account. So another thing that I wanted to point out, and it's related to technology, but just for the end of the session, is that innovation is not about technology, it's about mindset. Then, as I said, we can train people, we can mentor people, but innovation comes from mindset because it's going to be really challenging to, even if it's as simple as it is, it's going to be really hard to change a workflow inside a clinic. So we really have to have the right mindset to innovate, and this is what we have to support as leaders to our clinics. So thank you so much.